technologies are moving quickly. You're seeing many of them in the hall here today that have the potential to influence the future of health and medicine. And of course, medicine is a continuum, right? There's no one component. There's prevention, diagnostics, therapy, clinical trials. And we have an opportunity to look at all of those and how today and the future are moving very quickly to shift us from a sick care world, where we spend most of our dollars on the sick, to a healthcare world, and where technology can play a role in that. But today in our sick care world, we're very much in a silo of old thinking. We're defining medical issues by body parts, where the structures of medical schools and pharma companies are the same. And we live in a very intermittent and episodic world. We get an occasional blood pressure check, EKG. You still might be faxing data back and forth to your physician. And therefore, we're quite reactive. We're waiting for that heart attack or stroke or lump to be discovered at late stage. I'm a cancer doctor. I'm tired of seeing patients present with late-stage disease. The information is still scattered between medical records, paper, electronic, that don't talk to each other, and the feedback loops are often very, very broken. So we have an opportunity in this new connected age, digital age, genomics age, to unsilo healthcare, define it outside of the bucket of body parts, and move to a much more continuous era and much more proactive healthcare, where we can all play a role in owning our health information and being on top of our health, medicine, and therapies. So the models are set to be disrupted. No longer will you be waiting 66 minutes on average for a 9 or 12-minute primary care visit, whether you're here in San Francisco or Calcutta. And of course, technology plays a role in all of this, but overlying that, really, there are the incentives. Unfortunately, in the United States, we're still very much in a fee-for-service world. I'll get paid to do more procedures, more biopsies. We spend most of our healthcare dollars on the 20% of the population with chronic disease, not evidence-based medicine, but reimbursement-based medicine. But that's starting to change in this new value-based equation. We're going to pay for outcomes. Outcomes are the new incomes. So that's changing the incentives with technology to move things forward. Another big shift is, where's healthcare happening? No longer in the four walls of the hospital, the ER, the intensive care unit. The pressures are to never bring patients in the hospital in the first place, or to send them home sooner. So technology is taking health and medicine from the hospital to the home, to on our phones, to into and onside our bodies. So that now means you can be an empowered patient. You can own your own data. You can control that information. You can interface with your clinician. You're not just going to the paternalistic doctor and they tell you what to do. And there's more transparency. You can compare one hospital down the street from another, or the price of a drug from across the street, from a CVS to a Walgreens. So that gives a lot of power in our hands as consumers, and a lot of this new power comes through these amazing new connected technologies, right? We've only had smartphones for 9 years, essentially, and they're transforming how we do healthcare. They're moving very quickly, and they're becoming medical devices. And in fact, I live near Cupertino. I have a sneak peek at the iPhone 10, and here's the iPhone 11. And these are clearly medical devices, and as they move so quickly, riding Moore's law, they have the power to really change healthcare. So Moore's law is the power of computing. That's why the magic smartphones in our pocket have had 1 billion times the power and speed of computing of a supercomputer from the 1970s. And it's an exponential technology. Many fields are moving very, very fast. So you need to start thinking about exponentials across many technologies and how they can shift the world. Because we're seeing the desktop of 2000 fit on our smartphone, now fits on my Apple Watch. Computers now the size of a grain of rice are becoming connected and enable all these technologies to fit in your pocket. So with all these things becoming smaller, cheaper, and interconnected, we're bringing the Internet of Things to the Internet of medical things, the Internet of healthcare. And that has the opportunity to shift us to what's often called the world of digital health, or connected health, or mobile health. I think we'll just soon call it health. But the overlap of these elements brings us new ways to interact with our own data and for the healthcare community as well. In fact, Stanford just is launching a new Center for Digital Health. UCSF has one as well. So when you're thinking exponentially, it's no one technology. It's not just Moore's law. It's many technologies, from gaming and 3D printing and robotics and AI, all coming together and converging, which is giving us an opportunity to address many challenges we have in healthcare, from rising costs, aging populations, access, whatever happens with Obamacare or Trump care or Putin care. It's okay, comrades. We need new ways to think about addressing these challenges, from all the big data that's coming at us, to make it not just big data, but actionable information you can use as a consumer, as a patient, and to help our friends at the FDA, the F word, get out of our own way to speed up discovery, and our payers, the big insurance companies, to help reward these. So we're here in San Francisco, the heart of innovation. We've seen many companies and technologies reimagine and disrupt fields, like Uber. Of course, Uber is only a 6-year-old company. They couldn't have existed 10 years ago. They've ridden the exponentials of smartphones, online payments, online maps, connected the dots. They're being disruptive, of course, to the cab world. Though I was in Austin, you couldn't get an Uber there. We're seeing them bring in their own self-driving cars to disrupt drivers. So the future of employment is at stake. And even Uber's piloting with hospitals and clinics to bring patients to them. So this Uberization is hitting healthcare in interesting ways. The ability to press a button on the app and bring a nurse to you to give you a flu shot has already been piloted. And now there's an explosion. Oh, okay. Disruption. We're seeing now apps that are bringing back the house call. Press a button on the app and a doctor comes to you. Not sure what kind of doctor, but you get a doctor, and they can rate you and you can rate them. So this element of Uberization is coming. Bringing your drugs by Uber or Lyft or drone is here. And so we've seen these changes happen across many industries. It's coming to pharma, to medical devices, and to your physician, hospital, and to you as a consumer. So I get a spot looking at this convergence. I chair medicine at something called Singularity University. It's down the road in Mountain View at NASA Ames Research Park. And at Singularity University, we'll look at how do you understand exponential technologies and how do you leverage those to change the world in powerful ways and understand where they're heading and how we can bring those together to address grand challenges. We have a 10-week summer program called the GSP, which you can all apply for. The website is su.org, full scholarships where entrepreneurs and others come together to cross-fertilize and address grand challenges. In fact, of our prior programs, about half of the new companies and ideas have been focused actually in healthcare. And many of those ideas come from individuals from other fields, like many of you, from gaming, from IT, from 3D printing, et cetera. And now, because so much of healthcare is multidisciplinary, I founded a program called Exponential Medicine, where we bring the folks together from across the spectrum every fall to cross-fertilize and understand where we can reimagine health and medicine. So come join us this fall. Exponentialmedicine.com has a lot of talks and other information. Okay, so let's dig into a few topics now and where they are, where they're heading. First of all, health and prevention. We know that our genetics are important for our health, but it's really our behaviors that are much more impactful in the long term. And we're just in the era now where we can start to measure our behaviors, which drive most of our bad conditions and most of our costs. We can start to measure those with our wearable technologies. How many of you have a Fitbit on? I'm wearing 4 different versions of wearables. No one wants, half of you have them in their drawer at home. These technologies enable us to measure behaviors like steps and sleep. And it's fun for the Uber geeks, like many of us, to track behavior, but it's moving from quantified self to quantified health, where this data is starting to flow into the medical system. Like in England, the NHS is starting to pay for connected glucometers and blood pressure cuffs. And these sensors are evolving from simple accelerometers to pills that can track when you've taken them. We're seeing that you can measure almost every element of your physiology and your behavior using these technologies. Nokia, which was disrupted from the phone business, bought WeThings, which can now track health and medicine. You can track your swims, your tennis game. We're going from wearables on our wrists to inside-ables. Google, or Verily, is now developing contact lenses that can track your blood sugar, or other devices inside your skin or underneath the skin are soon going to be tracking all sorts of physiology in real time and transmitting that to the rest of the world. So tremendous ways that we can change how we measure this information. From inside-ables to trainables, something like our posture. Your mother may not be there to give you a nudge. You can put a little device on your back called the Upright. It buzzes your back when your posture's bad, and after about a week of wearing this for an hour a day, your posture is dramatically improved. It can be used to treat lower back pain, for example. Shockables, that Pavlov was on or something. Hearables, the new hearing devices, can not just track your music, but your heart rate and your steps. Ringables, this ring that I'm wearing, tracks my sleep. Sleep is something so critical to our long-term health, which is underappreciated. We can track that with sleep labs on our finger. Our clothes are starting to be embedded with sensors. So you can use those to run a marathon or to measure a patient who has heart failure or emphysema. For pregnant women, you can track the health of the mother and the fetus. And when that bundle of joy is born, you might even want to track other elements. And no kidding, the future's coming faster than you think, because Huggies came out with Tweet Pee last year. So all these things are trackable. The challenge is, when is it too much? What do you do as an individual, a parent, a pediatrician, with all that information? How do we make sense of it? Because that information is exploding. Like even a local company called Breathometer can track your blood alcohol level, but also the quality of your breath. Do you have maybe lung cancer? It can be picked up by molecules in your breath, so we can quantify breath. We're seeing that Wi-Fi in our homes can start to measure the vital signs of up to 10 people in the same room. So we're entering an era, for better or for worse, where our digital exhaust, terabytes of data, will be collected and analyzed 24/7. Now, that's a bit of a so what if you have to keep wearing different devices, if that data can't flow to your doctor or coach or nutritionist, and if we can't use machine learning and AI to make sense of that massive storm of information, of data to make it information. It also needs to work into the workflow of your poor doctor who's already overwhelmed with too many pieces of information and needs better user interfaces in the current EMRs. So this is starting to happen. If you have an Apple phone today, you can start to look at your health data on HealthKit. But now in some centers, like at Stanford, I can opt in. I can connect the data from my phone directly into my medical record, and my physician can see that data. So again, that quantified health is starting to come and is starting to connect those dots. That data is coming to our smartwatches. And we're going to see more and more that the consumer companies, the Apples, the Samsungs, the Googles, are enabling us to touch these devices and have insights into our behaviors and our chronic conditions to help manage them in smarter ways. So I think where this is heading is kind of like our modern cars. Modern cars today have 300, 400 sensors in them. You don't care about any one sensor. You care about when your check engine light goes on. That hopefully means you're proactive and you come in and get care for your car. We'll see, I think, the equivalent of that, the software integrating the connected devices and your own data, your omics, to make sort of the OnStar for the bodies to bring us into the future. And we'll start to share that data, kind of like Teslas update through the cloud. They use a hive mind. All the self-driving Teslas are improving the maps for the next Tesla that comes down the road. So we can start to crowdsource this information. And again, it's a lot of data to put together. What if we had a FICO score for your health, not just your financial information? And you can integrate that from your sexual health, your social network strength, to your financial health. And what if we could be honest with that information to help us guide our prevention, diagnostics, and therapy? Because we know behavior change is hard. So we're starting to see digital coaches come, coaches embedded in your app, like an AI app like Lark that can help make fun interpretation, remind me that I haven't gotten enough sleep last night, for example. We're seeing it come to our Amazon Echoes and our Google Homes that will be coaching us to manage diabetes or call for help when we need it. We'll see coaches in our mirrors in the morning. When we wake up, we'll see our coach. They'll show you of today, but maybe also you of tomorrow. You of tomorrow if you're working out, if you're doing your P90X, or you of tomorrow if you keep having donuts for breakfast. That can be a change. So here's me now, here's me 1,000 donuts later. That might change my insights and my behavior. Or if you spend too much time smoking, before smoking, after smoking, on your own face, that can be a very powerful lever. And that's or too much time on Facebook, that is also an issue. So we're seeing these new tools combined, convergence of augmented reality, right? My Google Glass is already an antique. Google Glass has great applications in the operating room. We're seeing HoloLens, for example, being used to train medical students to learn anatomy, or you can learn your own anatomy and physiology using these new tools at very low cost. We're seeing augmented reality come to do education and medical simulation for both education and using that in the operating room. Meta, a local company, is blending augmented reality so you could learn or interact with all sorts of data. So, of course, these tools are converging in interesting ways. I can have an app on my phone where I can literally look at my smart shirt here and see anatomy through that. This is a video of that. It's great for kids to learn their anatomy as well, for example. So my son Leo, who's 2.5, who's here somewhere today, he can see where his heart and his lungs are and learn. So fun, interactive ways to use AR and VR. Of course, then there's virtual reality, the expensive version, the low-cost versions. They're being used now even for therapy to treat folks with burn injuries, to put them in cold environments so they can lower their need for pain medications. We're seeing it being used in the operating room to record or live stream virtual reality surgery. So some people around the world, in this case, I was there, the first live stream VR surgery. 5,000 people were watching a surgery in real time. And of course, Snapchat's even been used in the operating room to record and being used for medical education. So whole new ways we can shift many elements of the healthcare enterprise, including ways to train, or as Adam talked about, gaming, everything from your runs to your biking to things like Pokemon Go, which really got people moving and out of the house. Old school technologies like meditation, as Adam mentioned in the last talk, can be used to look at our brains. These are brain-computer interfaces you can use to optimize your mindfulness training and meditation, or to treat things like attention deficit disorder. So we can take consumer devices and appify them, and that's disruptive to the drug companies who might want to sell you ADHD drugs. We're starting to digitize our genomes. The price of sequencing your genome has dropped at twice the rate of Moore's Law, from $1 million a couple years ago to about $1,000 today. You can do 23andMe for a couple $100. There's lots of data there, including your drugs and what drugs might be impacted by your own genomics. So what if your doctor had your own genomic information and would prescribe the right drug and dose based on that, for example? So that information is there today. You can get your whole genome done for about $999, and it comes with an app. And we're learning to understand diseases. Like type 2 diabetes is actually several subtypes. We can use machine learning to understand that, and everyone will get a much more genomically diagnosed element. Helix just launched, which will be an app store for your genome. So an example of an app for your genetics, I can now take my 23andMe data, upload it to Athletogene, and look at my athletic ability. And sure enough, I'm a pretty fast runner, metabolic efficiency 77, not great at cross country, endurance 34, and I wanted to get up and do my workout this morning, but I had trouble getting out of bed. I can blame my parents, though. My motivation genes are low. So, that's a complex data coming together. And now we're going beyond the genome to things like the microbiome. The bugs inside our gut and in our body play a role in everything from inflammatory bowel disease to obesity. Local companies like Ubiome now enable you to sequence your own microbiome. We're starting to use that and understand how that impacts things like psychiatric diseases. And we're even doing fecal transplants to cure some folks of bad GI infections. How about the future of diagnosis? We want to pick up disease early rather than late. We have a whole new set of diagnostic tools that you can use in your pocket, in your home, to look at ear exams through otoscopes. Pocket ultrasounds now that used to be $100,000 can fit and attach to your smartphones to look at the hearts and other anatomy. These devices are becoming integrated and won't just be in the clinic, but will be in your own pocket. You can do a derm exam through your smartphone and apps today and see a real dermatologist, or increasingly that dermatologist will be an AI dermatologist, and the app can tell you, is that a melanoma or a mole? Eye exams are shrinking to attachments for your smartphone cases. So the whole way we're going to diagnose will move from outside of the clinic to our pockets and our homes. This is a local company called AliveCore. A little attachment on your smartphone can enable you to do an EKG and diagnose heart disease, and folks with heart disease can carry these with them 24/7. They're coming to your watch. And we're having patches now, like I'm wearing a patch right now that's streaming 24/7. My EKG, my temperature, my heart rate, my movement. That's an intensive care unit in a Band-Aid. The challenge is, what do we do with all that information? Who's monitoring it? And when you do pick up heart disease, there are now new ways to analyze your cardiac function. You can do a 30-second CT scan, send that data to the cloud, and now analyze your blood vessels. Are they narrow? Do you need a bypass? Do you need a stent? Maybe we'll 3D print that stent to match your anatomy. Another local company called Autoris is able to do MRIs and integrate that data in the cloud. In fact, just last week, they had the first FDA clearance for artificial intelligence cardiac diagnostics. So these things are all coming together. And we're seeing new prizes and new technologies come together. The X Prize, which I've been involved with, has a $10 million prize to make a medical tricorder inspired by Star Trek. One of these local companies called Scanadu has made a medical tricorder. Hold it to your forehead, pulls down your temperature, your heart rate, OJSAT, talks to your smartphone with IBM Watson embedded in it. So we're seeing these kind of technologies come together, not just for vital signs, but lab data. You can dip a dipstick in the urine, and your app can analyze your urine and send that information directly to the CDC, to your doctor, to the NSA, whoever else wants the information. So lots of ways we're going to see these come together in our pockets to empower us to pick up disease early. Lab on a chip. You can do a lot at home now with laboratories on a chip. Some you can even print out a test for Ebola or Zika virus. So with all this new data, how do we make sense of it? Our brains haven't had upgrades in millions of years, but now with artificial intelligence, or I like to call it intelligence augmentation, we're starting to make sense of that. We're going to see AI play a role across healthcare and hopefully not replace the doctor, but enhance that a very important patient-doctor relationship. So I think technology can help, not hinder. How about the future of therapy? We want more personalized, less invasive therapies. We're now in the era of gene editing. CRISPR, invented at UC Berkeley just 4 or 5 years ago, is going to start curing diseases like sickle cell disease, taking out the bone marrow, replacing the bad gene, and retransplanting and rebooting the blood and immune system. It's now moving into clinical trials for cancer. We're seeing electroceuticals, not just pacemakers for the brain, but for the heart and the brain and the gut. Some electroceuticals for treating things like sleep apnea, or electroceuticals for contraception. You know, honey, where's the remote? What happens if someone hacks your remote or hacks your pacemaker? Big issues that relate to privacy and other technologies like blockchain that may help us solve that. The future of therapy is coming to apps. I might prescribe you an app for pre-op or post-op care. Mayo Clinic has shown they can reduce heart failure readmissions to the hospital by 40% by prescribing patients apps. There are now FDA-approved apps for diabetes, a whole new set of diagnostic glucometers. Some of them come with coaches and coaches and social networks built into them. So the era of the checkup is changing. Digital checkups that you can do with your smartphone are already here. You don't usually see your doctor, but soon it may be your physician you'll see through these devices. Chatbots are coming to healthcare, so you may, before you see a physician, do diagnostics on chatbots. And the way we interact with our physician may be leveraging some of these new AR and VR technologies as well. Robotics is coming fast and furious to healthcare. We've had robotic surgery for several years, but robots are coming to hospitals to deliver things. We're seeing wearable exoskeletons that can help the disabled. This woman's paralyzed from the waist down. She's wearing an exoskeleton with 3D printed parts. 3D printers, a lot of them here in the room today, is coming to healthcare to print prosthetics for kids who might be missing a limb, to replace the old-fashioned cast with one that is personalized to you. Knee and hip implants are being 3D printed. We just flew the first 3D printer to the space station, one of our SU companies. Hard to get medical devices there. The first 3D printed medical devices were printed there last week. So new ways these things are blending as we move forward. You can even print yourself and prosthetics for individuals who need them. Printing pills is coming fast and furious. Printing organs, not quite there yet, We may be printing organs in the not-so-distant future using your own stem cells, but before that, we're starting to see using gene therapy to modify pigs and humanize them, so we may be getting organ transplants from pigs. Not kosher, but might be very useful. Okay, last 2 minutes. Global impact. These technologies don't need to make healthcare more expensive. They can democratize it. The poorest on the planet, the bottom billion, all have smartphones or have SMS phones. Soon they'll have smartphones. And Google and Facebook are bringing internet activity to billions of people in the next few years. So information is power, and even remote locations will start to bring them drugs, vaccines, and other things through drones, like companies through Matternet, or defibrillators, or other elements. Last point is, we can all become part of this future of healthcare. You now can be part of clinical trials by downloading a clinical trial on your smartphone. ResearchKit has several examples. Trials for heart disease, for Parkinson's, for autism. So this brings us to the future. 10 years ago, we used paper maps. Now you couldn't imagine driving without Google Maps or Waze. I think the future of healthcare is going to be crowdsourcing. Getting information back, like the traffic, like you do when you donate data to Google Maps and Waze, will be part of the future of healthcare. So we can all not just be organ donors and blood donors, but data donors as well. So realize that the puck is moving quickly. Don't think about 2017, think about 2020. Skate to where the puck is going to be, like Wayne Gretzky says. Think convergently, where all these technologies are coming together, and how many of you who are not in healthcare can apply your thinking and your passions to address challenges we have in medicine. And if we do that together, we can move from our sick care world, episodic, reactive, intermittent, and siloed, to a true era of healthcare, continuous, proactive, and participatory. So let's all take exponential steps, not linear ones, and not predict the future, but go out there and boldly create it together. So with that, thanks very much.